Yeah. Hi, Nicola Perry-Gower, the long COVID clinical lead and long COVID pathway coordinator for our health board.
I'm Sarah Woods. I'm a GP by background, and I'm working as a GP in the long COVID rehabilitation service in Swansea.
Hi, I'm Dr. Kate Hollyman. I'm a GP and I'm the GP clinical lead for the long COVID service in Swansea Bay.
We were given the brief really to coordinate long COVID services across our health board's footprint, and part of this process really was to explore virtual solutions for patient care, and hence why we really looked then into virtual group consultations with our patients as one of those solutions really. So that's really where we started, from funding from Welsh Government and looking at what we provided already for our long COVID patients, and then really just exploring other avenues for that really, so that patients got that most appropriate treatment at the appropriate time in the appropriate place really.
So when I started this role, the MDT, the multidisciplinary team, were running a fantastic rehab course, but this was something that only suited a certain group of patients. Some patients fell outside the criteria for this sort of program, and there wasn't really anything else suitable for them. So with the virtual group, it's something that it will cater for patients who perhaps have mobility or transport issues, or weren't suitable for the sort of main part of the long COVID treatment. So it was a way of reaching more patients. Oh, partly because those patients that couldn't attend the face-to-face group had issues with transport and mobility, or were too unwell to come in, um, and or were working full time, and taking the time out to come to things was more difficult. So it made it more accessible for those patients.
I think one of the challenges really that we do have a waiting list for our patients really. In long COVID, it's a very new condition. There's not a lot of research out there at the moment, so we're actually in the role of trying to find out what is most suitable for our patients as well. So at the time, we have got that multidisciplinary rehabilitation service, but it's adding on to that as to what is most appropriate for those patients. So it really was a lot of exploring different avenues, different issues around what would be best for our patients with many, many symptoms. So one of the really good things around virtual group consultations is a lot of our long COVID patients suffer with fatigue and what is known well out there of brain fog. So it's just that concentration. So with travel time to groups as well. So this would save that part of that. But also what you had over with the virtual group consultations, you still had, even over a screen, you still had face to face and that peer group in interaction as well with our health professionals and our GPs.
So one of the first things that we did was when I started assessing the patients early on, before they'd attended the rehab group, and I was able to sort of triage patients to whether the rehab group was the best option, and if it wasn't, I explored with them as to whether they would be willing to attend the virtual group, and then we were able to sort of develop a pool of patients who could attend one of these groups. And then after we'd been on the training, we started these groups, and then it sort of evolved so that the virtual groups became part of the pathway with time.
Just thinking about the journey so far, it's been very, I suppose from my point of view, it's been something very different that we've been involved in, and quite exciting to do something with a group of patients, because it's a whole different sort of dynamic than having a one-to-one, and the newness means we can still have that one-to-one with them on the phone before, when we're triaging, and then we can decide if they are going into this virtual group, we can see how they interact with other people as well. And that's been a really interesting, I suppose it's been a huge learning curve for us as well, because it's definitely out of the comfort zone compared to things that we've done before, but definitely a worthwhile experience overall.
So our pathway really starts with patients being referred in, where we will just have a paper triage, and then they are all invited to a webinar, which means that we can invite a lot more patients at one time, and that's where our GPs will deliver an hour to an hour and a half session of self-management advice on their symptoms. From that, if patients will attend and they still need our advice and support, then they'll await a one-to-one phone call consultation with one of our GPs, where they will assess them and see what's most appropriate for them, and then they can either point them towards our virtual group consultations or our face-to-face rehabilitation if they need more intense therapy from our multidisciplinary team, or again at that point they can also be discharged if they feel that they've had enough advice, and will be sent off with a resource pack.
Just to say, I think the webinar was a useful addition to the pathway, because we were finding that we were repeating ourselves a lot with very similar advice in our patient telephone assessments and consultations, but also patients didn't generally know what to expect. With normal, more standard hospital appointments, they kind of know what they're going to get, but with this long COVID pathway, there were some quite varied expectations. So at the webinar, we were able to sort of set the tone, explain what was going to happen, and set the expectation at the very start of their journey, so that then everything that, you know, all the other interactions that came later, we were able to build on that. So it was an efficient way of covering all of that for a lot of patients early on in the referral process.
Yeah, we've found that the webinars have really helped with our telephone triage, because if they've attended the webinar, they've already had a lot of self-management advice in various different problems like fatigue or breathlessness, and therefore that can sort of speed up our one-to-one consultations, or you know, see how they're doing along their journey with that advice already. So it's been a really helpful thing.
So the information that we need before the patient joins the virtual group clinic are some basic information, but including some security information ready for when we sort of log them in securely to the clinic, and which is done by the facilitator at the start. The clinics are then an hour and a half, which includes 45 minutes to an hour of the clinician time.
For the patients join the virtual group clinic, we've had, when we've spoken to them, we'll have gained some security information from them, because they're joining a group to protect confidentiality. So that's some basic details about their where they are, and a security word. And then when they join the virtual group, it's simply clicking on the link from the email that's been sent to them. So most people have managed this you know, fairly well, really. And the clinics themselves last about 90 minutes. The first initial 10 minutes to 20 minutes is taken up with doing the security information and going through PowerPoint slides that describe the confidentiality aspects and the security information. And then we move on to the facilitator helps really gain questions from the patients about long COVID, their general questions and maybe individual questions, but we try and keep it fairly general. And that's the first section. And the second section is a check-in one-to-one with the clinician and the patients, if there's any particular questions that they haven't had answered already. But we really do try and encourage lots of group interaction and hearing stories, because the patients really seem to gain a lot from that. Yeah, so it's been a really an interesting experience to take part in.
So we often invite around 10, slightly more patients, and frequently people can't make it on the day or have to rearrange. So most of our clinics are sort of between 4 and 6 patients attending. The facilitator helps guide them in sort of putting their questions forward towards the clinician, and then the facilitator will group the questions into themes to make it easier to discuss the different topics, sort of troubleshooting the common symptoms essentially. And then at the end as well, after the clinician's gone around each patient as well, checking if there's more specific questions, they'll help sort of encourage the patients to come up with a goal or something that they've taken away from the day, something that they might go away and do differently or look up or try in terms of moving forwards and making a plan. So often the main feedback points we get from patients is how grateful they've been to be able to share their stories with other patients and hear of people experiencing the same problem. So I think one of the real strengths is the fact that they've got that peer support, and one-to-one assessments would probably take longer, but also they wouldn't have the benefit of that peer support, which is actually a big part of the therapeutic gains of this clinic.
I think from our point of view, with regards to the virtual world, I think it is very new. And I think it's around not underestimating how much time it does take to plan and allow yourself that time to grow within that kind of scenario, because it has been very different. We're very used to, as clinicians, being very face-to-face, very hands-on in that sense. But this is now a platform that has opened up a lot of opportunities for us. So I think from a webinar point of view, it is now allowing us to look at efficiencies in the fact that if people do attend, that's fantastic, and then we'll push them onto our other parts of our pathway. But it also pushes that co-production with patients as well, so they have to meet us halfway, and if they don't then come, we will unfortunately have to discharge those patients. But that again is part of the efficiency of our waiting lists. But what we are seeing then is we're getting those appropriate patients that attend our webinar that will have that one-to-one consultation with our GP, and then the virtual group or the face-to-face rehabilitation where you are getting those patients actually attending. But it is a work in progress. It's really working on how we best get the right patients to the right treatment for them, and so that has been one of the issues I feel within this. But it's allowing yourself that time to discover and change and adapt and look at those areas as well, really.
The webinars and the virtual group clinics give patients a lot of information about self-directed management, really, and the webinar particularly is the first part of the pathway, the first appointment in the long COVID pathway, and it gives them a lot of information, whether they're coming from a background where they know a lot about long COVID already or whether they have very little information, and it covers all the main areas, sort of breathlessness and fatigue and brain fog, and giving a lot of resources for them to look in their own time as well. So it's not just that hour and a half, it also gives them a lot of things to do in their own time to look up. So I think it can really help sort of them with feeling empowered, really, to help themselves, and it sets the tone for the future appointments that they have. So if they're coming in then into the virtual group clinic, they already had looked up some things already or tried some things out that they can then discuss with their with their other peers in the group. So I think it gives a good amount of information about self-management, really.
The real magic of the webinar is the interaction and the questions. So we go through the slides in a very sort of educational session way, discussing the symptoms, but at the end we leave a really long period of time for questions. So patients will ask all sorts of questions, and they've often got the same sorts of things on their mind, and we answer those questions as honestly as we can, and you can sense the patient's relief. In fact, one of the quotes on the webinar feedback was, "Thank you so much for this. I'm crying with relief," because often patients, and we know this as GPs, often patients, when they're waiting for a service, have just got a couple of questions that they want to ask or bring to that appointment, and those can be answered straight away at the webinar. And we had 50 patients on our last webinar, and we were, in an hour, were able to give all of those lots of information about their condition and then answer the specific questions as well. And then when they come to the when we phone them for the telephone assessment, we can build on what they've learned in the webinar. So I had a chap this morning with some breathing difficulties, and I said to him, "Oh, do you remember that we talked about the sort of fight or flight response and the breathing pattern problems in the webinar, and he said, oh yes, and then I was able to then expand on some of those ideas and theories and direct him to some breathing exercises and websites and refer him on from there. And then same with the virtual group. I think it's the magic's in that interaction and their questions, and the fact that they realise that the other patients have got very, very similar questions to them, and they find that really reassuring, and that really helps.
So the virtual group clinics themselves and the webinar has been a completely sort of new experience for us as clinicians, but it's been definitely quite an exciting process to be part of. Initially, I think it's quite daunting because it is new, and it certainly has taken a few of the clinics to feel a little bit more, in step with what we're doing. But as we've sort of mentioned before, really, the best thing that I've gained from it is seeing the patients interact with each other and seem to gain most from that. So whether it's the webinars or the virtual group clinics, when they're interacting and hearing and helping each other really with tips or advice, and we've learned from them as well, because obviously they're experiencing their own journeys, and that's been a learning journey for myself, rather than the initial feeling of wanting to impart what knowledge I have. It's more taking a step back and reflecting it back onto the patient and the other patients there, as saying, what has anybody else experienced that, and what have you found helpful? Has been something that's it doesn't come naturally when you're used to sort of talking with patients in probably a more clinician-centered way, whereas actually this allows the patients to be or patient-led really by their own questions, and then helping each other with their answers. So that's definitely been a learning curve that's that's improved over time for myself and colleagues, I would say.
It adds variety to our working day. Some weeks we'll have a webinar in the diary. Some weeks it might be a virtual group, and it keeps the job interesting, especially with a job like this where we're just dealing with long COVID patients all day. There's never a dull moment, and it's always a bit different. So I'd really recommend working like this. And it's also fantastic having sort of like a menu of options that we can give to our patients. So there's often something that will suit different people, and you get a feel of which different things will suit which patients, which I think improves us with time as well, that instinct of what the patient needs.
I think really overseeing things and not necessarily being involved in the delivering of the actual services, it's been an interesting journey, and just to see all of us as different clinicians connect in planning and developing the services, having an outside company with the expertise in helping us and steer us in the right way has been invaluable, and really we wouldn't have been able to, I don't think, have achieved what we've achieved without that support, because I think as both Kate and Sarah have said, it has been quite daunting in the virtual world, but the benefits that we're gaining, and still gaining because we're still improving and we're still practicing and we're still trying, again, for our patients, it really, really does help them and support them in a lot more of a timely manner than sitting on a waiting list. And this is what we really need to achieve with technology, if we can. And I think it's been a fantastic service. I'm really proud of everybody that's been involved in that, and I think we deliver some really fantastic information in quite a short period of time. So it really, really has helped us deliver our services to our patients with long COVID in Swansea Bay.
I would say one of the top tips is to make sure you've got some good admin support. So we've had a good team using spreadsheets to collate everything and set everything up, and having somebody that understands the system and can set all of that is really, really useful, because then the clinicians can just turn up and do their bit, and it makes it really, really efficient in terms of clinician time.
The role of the facilitator is such a vital and and at times tricky job to do, having to coordinate all the security information plus delivering the security and getting sure they got all the passwords, and also making sure that the flow of the questions, the whole and the timing of the session as well goes well. It is quite a tricky job, but having a good facilitator is or training up a good facilitator is essential.
Yeah, I think the virtual services lend themselves to continued kind of assessment and improvement, because at the end of each session, you ask the patients what went well and what they think might be able to be improved on. But also, after one of those sessions, the clinician and the facilitator or the team tend to have a quick chat, and then we've been making little changes each time and sort of altering bits or sometimes bigger changes. And I don't think that happens in normal clinical care quite so much. This sort of assessment, this involvement of patients into how they think it went and what they might have found useful or better. So we've certainly done that all the way, and the feedback has often been really, really useful and helpful in guiding us in what we're doing.
A top tip for me would be around preparation, ensuring you've got all that information beforehand, having those conversations with your team, but be prepared again for that evolvement. And you're going to change. It will change throughout, and it's important to do that as well, to improve the services that we deliver as well.
A top tip in terms of the clinician point of view, it's so tempting when a patient asks a question to just dive straight in with an answer. But I sometimes find that I take a pause, a little deep breath, pause, and it just allows me to remember that I want to be involving the patients in this, and that little pause and deep breath. And then I often come out with, well, what have you found so far? Or tell me a bit more about that. Or have you found anything that's helped with this? And it immediately allows the conversation to flow and the patients to be involved. So that would be one top tip, just a little pause and a deep breath before diving in.
Another top tip, just remember, not everything is going to be perfect every time. And I think that's, again, really, really important, because actually what we are delivering, what we are getting through and working with our patients on is actually some really, really good advice that's well researched as best we can. So yeah, not everything will always be perfect.
Another top tip is to just dive in and give it a go. So it's often very daunting to start with before the first one, but when you try it, it's often easier than you think to actually do the sort of clinical process, and you'll quite quickly spot the bits that perhaps you do need to work out on, which is often more the actual practical side. So yeah, having a trial run or just diving straight in with patients, and yeah, it's the best way to learn and prepare is actually to give it a go. First 10 or 15 minutes when the patients are logging on are really important. We had one patient who came on who wasn't feeling very confident with computer use, and she was a little bit flustered when she first logged on, but our facilitator in that sort of 10 minutes at the start talked her through how to access the chat box and how to use the mute and unmute button in the virtual group, and she sort of settled into the pattern of it, and by the end you could tell that she was very relaxed and interacting and sharing with the other patients, and actually she seemed really kind of happy and proud of herself by the end of achieving that. So that facilitator in that first 10 minutes is really important, and allowed that patient to get a lot out of the clinic and the experience from a clinical point of view, but also from a life experience and confidence building point of view. So you don't get that in normal consultations. There was one virtual group clinic we did where we had patients with hugely varying levels of knowledge of long COVID, and it was a little bit daunting to start with, but actually we found that if it was managed well through the facilitator and the clinician, it was actually quite useful. There was one chap who'd done a lot of reading and research about long COVID, but sort of him discussing that, we were able to answer his more detailed questions, but then we were able to sort of simplify it and explain it to the other patients. And they were able to also gain a lot from his knowledge and questions and ideas, as well as perhaps some of the others then listening into that discussion. So the varied levels of kind of knowledge about their condition can be a real positive point, as well as sometimes a bit of a challenge. There was one virtual group clinic where we had a lady who seemed to be really struggling. She was very down, and at times she had her head in her hands and sort of wasn't engaging, and we were concerned about her. So we called her up afterwards to make sure she was okay, and that was able to lead on to a bit more sort of one-to-one support and interaction with her GP to get her some more support. So the virtual group clinic can be useful at flagging things like that up, and doesn't need to be seen as a a standalone thing. It's a part of the whole package. And it was useful to have noticed that. You might not have picked that up on the phone, her body language and facial expression, but on the virtual group clinic, you get that.
So one of our patients, we had a 53-year-old nurse, female nurse. She's got 3 children. She's worked in the NHS since she was 18. She had COVID, left with symptoms really of breathlessness, palpitations, really couldn't exercise anymore, couldn't walk very far. And really from what she was saying, and she had contact with one of our GPs, with Kate, and through the virtual group consultation as well, and she felt that it was the breathlessness, her brain fog and her heart rate that she was really worried about. But when she spoke to the GP and on the virtual group, we were able to talk about those symptoms of fatigue and brain fog and the breathlessness, and she was given those tools and some websites and some things to look at, which she did. And as she said herself, she's very much around trying to sort this out herself. She was getting really frustrated and initially thinking that it was just driving her mad and that she was crazy. And one of the things that the virtual group helped her with was talking to other people and the clinicians. It was really about acceptance, but also validation of those symptoms. And then really she talked about getting her control back, which I think is really, really powerful.